Every medical practice owner seeks financial stability, but the path has hidden pitfalls. What if your practice is unknowingly losing over $125,000 a year? For many, it's a reality. Conversely, practices addressing this see a 20% cash flow increase, often within 6 months. The difference isn't working harder. It's having the right financial expertise in your corner. We will show you how a healthcare CFO finds that lost revenue and builds a resilient strategy. So, why are these problems so common? Many practices operate without a formal financial plan, reacting to issues instead of preventing them. Some believe a bookkeeper is enough, but that's a historian for your finances. A CFO is your forward-looking strategist who interprets the past to shape the future. Healthcare isn't like any other business. A specialized CFO understands the unique language of reimbursement models, payer conduct, and complex regulations. This strategic oversight directly impacts your mission. By offloading financial complexity, physicians can concentrate entirely on patient outcomes. We have established the why. Now let's get into the how. Where does a CFO first look for that lost $125,000? It starts by dissecting your practice's financial engine, the revenue cycle. But how do they pinpoint the exact problems in real time? First, they overhaul revenue cycle management. This means accurate coding and timely claim submission every time. Next, they analyze your payer mix. Are you over-reliant on low-margin payers? This data informs negotiation strategy. Then, they analyze service line profitability. Which procedures are your financial drivers, and which quietly drain resources? These analyses are not one-time fixes. They are ongoing processes that provide the financial clarity needed to make informed decisions instead of guessing. To manage this, CFOs don't depend on intuition or old reports. They build and implement the instruments needed for real-time financial command. So what do these instruments actually look like in practice? Let's look at the cornerstone of daily financial command, the KPI dashboard. Imagine a dashboard showing your days in accounts receivable, how fast you get paid. It tracks your operating margin and calculates cost per visit, exposing inefficiencies. This isn't just data, it's a diagnostic instrument. If days in AR creeps up, you know instantly there is a problem in your billing cycle, permitting immediate intervention. So, how do CFOs pinpoint problems in real time? This is how. They turn complex financial data into a few clear, actionable numbers you can monitor daily. Often, this involves advanced health IT reporting tools. The right technology, guided by CFO expertise, can directly reduce operational costs by up to 15%. Finding revenue is one part, but a CFO's role goes much deeper. It is also about protecting the practice from significant, often unseen threats. Healthcare is a minefield of regulations. A CFO implements internal controls and audits to ensure compliance, preventing costly fines. The entire payment model is shifting to value-based care. A CFO builds the financial models to manage this transition profitably. Growth requires new technology. A CFO provides disciplined capital planning, so purchases support strategy without hurting cash flow. This is the essence of proactive financial management. It's about anticipating challenges and building a financial structure strong enough to withstand them. So let's connect the dots. How do these individual functions combine to create a truly sustainable, growing practice? Recall those KPIs on your dashboard, like cost per visit. They are the exact data points you need to prove efficiency and succeed in new value-based care models. A clean, efficient revenue cycle doesn't just increase today's cash flow. It creates a scalable financial engine that can handle rapid growth without breaking. This is why the CFO role is profoundly different from a bookkeeper. It's about changing the data your bookkeeper records into a strategic roadmap for growth. In short, a CFO turns your financial operations from a reactive necessity into your practice's single greatest strategic advantage. We've seen how a healthcare CFO plugs revenue leaks, provides critical data for decision-making, mitigates risk, and prepares your practice for the future. And this level of strategic leadership is no longer reserved for large hospitals. Fractional CFO services make it accessible for practices of all sizes. The goal is to move past financial stress and uncertainty. It's about gaining the freedom and confidence to focus on what you do best, providing patient care. Stop leaving money on the table. It's time to transform your practice's financial health. A dedicated healthcare CFO can be your strategic partner.